Martina on the webinar.
Yes, we are. The broadcast is now starting. All attendees are in listen-only mode.
From the Unified Command, my name is Fields Mosley. I'm the Communications Director and the lead PIO in the Joint Information Center. So we'd like to thank you for being here today for this news conference. Thank you to our friends from the news media for joining us and asking great questions today. Also, thank you to members. Is about 3 critical parts needed to surveil and control the disease in our county moving effective equipment. We also recognize that a number of you might have questions about the latest data that was released earlier this morning, and we certainly feel for the families and friends of those that we've lost. Dr. Rebecca Sonnenschein, Medical Director for Maricopa, is going to speak first today, followed by Robert Rowley, who is our Director of Emergency Management here in Maricopa County. He is going to talk about personal protective equipment, how much has been distributed. So members of the media, the same instructions I've been giving for the last couple of weeks, we're going to be calling upon you, our moderator who is a part of the webinar, and that is when he will unmute your microphone. If you have your hand raised virtually in the webinar, please make sure your microphone is unmuted on your phone so you can ask your question. Please ask one question at that time. We've been able to get back to second questions every time we've done this, so we will certainly do that once again. So if you're having difficulty glitch in the program because of the extreme use in the GoToWebinar software, we cannot fix that on our end. Those kinds of technical difficulties. We'll certainly give you a chance to ask your question once you rejoin. You can also join us through the phone number provided in the instructions for you. For the first time today, Joanna Molina from Public Health is going to be joining us as well. So when we get to the Q&A portion of this press conference, she will come up and she'll also answer once it's stated in English, she will answer that question in Spanish. And if any of our Spanish language stations or reporters need some follow-up to this, we'll be happy to take those after the press. I would like to introduce you to Dr. Rebecca Sonnenschein. She is Medical Director for Maricopa County Public Health.
Good afternoon. Oh, it's Rebecca, R-E-B-E-C-C. So I want to talk to everyone about contact tracing. It's been getting a lot of attention in really on just a daily basis. So contact tracing has been a fundamental public health practice for over a century, and are most familiar with contact tracing in the setting of sexually transmitted diseases or tuberculosis or even measles. Disease spreads from person to person. So how does it work? By the provider and sent to a laboratory. It takes up to 3 days for that specimen to actually. So the lab then runs the test and sends that result electronically back to the Arizona Department of Health Services. DHS receives that test result. It gets automatically loaded into a system called MedSys, which is our electronic disease reporting system, feeds automatically to the county, where the infectious disease investigators and nurse epidemiologists can download that information from the report. And that's where the Maricopa County investigator first learns about a positive case of COVID-19. So the investigator will review that result, pull the information from the source as the investigator contacts the case and does an extensive interview. They ask the case about all of the people in their household because in the household are at the highest risk of being exposed and infected with COVID-19. They also ask about healthcare workers who saw the patient while they were infectious and who have equipment. And they also find out who else was in the facility during the time that they ask about community contacts based on how much time they spent with the person while infected. So the investigator is trying to decide who of the contacts could be at risk for exposure. And that means that they spend at least 10 minutes within 6 feet of the person, starting at the time period 48 hours before the infected person ever developed symptoms. And that's what we've learned during this process, is that before they develop symptoms. And that's why we go back those 2 days. Those 2 days before symptoms began, and walks through every activity, every meal, and finds out who the person was involved to make a determination about whether that individual would be considered exposed. As you can imagine, this interview can take anywhere from 3 hours, depending on what language the person speaks, how sick a person is, how long that time period is that the person was infectious and out in the community, and how many people they had. And part social worker, trying to establish rapport with this person that they've never possible without judgment. They also have to interpret the information as they're hearing it from a technical of who is exposed, how they were exposed, and what level of risk there is. And this is especially true when investigators have to, did you go to work while you were ill? It's important that they get truthful answers and that people know that they are not. So during the interview, the investigators are taking note of all of the locations of all the people who could have been exposed while the person was infectious, contacts, healthcare workers, and anyone who may have treated COVID-19 are then called by that same interviewer and given information on what symptoms to look for with COVID-19 and what they need to do if they develop symptoms to get treated and to avoid exposing others. It's important for to know that these conversations are confidential, and when they're calling the contacts, the investigator never mentions the name of the person infected, and they also don't provide information that would lead to figure out who infected them, or who exposed them. So we take confidentiality very, very seriously, even during the interviews of exposed and who else might have been in the waiting room or in the facility. And then we check up on the close contact. This might check in at the end of the risk period when the person might develop the disease. Usually daily, to make sure that they have access to food, how to seek healthcare safely without exposing others in the doctor's office, urgent care, or ER when they go. As positive, they're considered a case, and then they are called by an interviewer, and the whole process begins again. So this is traditional public tracing. About a month ago, as cases rapidly increased and the stay-at-home order went into effect, we changed our investigation process to case-mediated contact tracing. We worked with the case to reach out to their contacts and provide them with all the instructions that public health has doubled the amount of staff that we have doing investigations. We're up to about 25 now. And this includes 5 dedicated 100% of the time to supporting long-term care facilities, which includes skilled nursing facilities, nursing homes, group homes, assisted living, all techs, facilities. There are far more than 500 of these in the county, so we have an incredible amount of staff time dedicated to just these facilities because we know those residents are at the highest, scaling up our capacity from where we are now to 8 to 10 times that capacity. So that those case numbers will continue to rise with potentially hundreds of cases. And once the governor's orders are lifted, people are going to have a lot more contacts during more specific information on that plan coming very soon. Thank you.
Thank you so much, Dr. Sonnenschein. Of course, she talked a little bit about testing and how that's related to contact tracing. All these are in for a big picture, but in order to do more testing, you have to have personal protective equipment for the healthcare providers in our community. To talk a little bit more about what we've done so far, to members of our community, I'd like to invite Robert Rowley, our Director of Emergency Management, to come up here.
Good afternoon. I'm Bertrowley, and I'm the Director of the Maricopa County Department of Emergency Management. The Maricopa County Unified Command, which includes the combined efforts of protective equipment, or PPE, for healthcare workers and first responders on the front line of our fight against COVID-19. Is prioritizing the distribution of our limited supplies. High priority is given to acute care hospitals and EMS transport, and an even higher priority is given to long-term care facilities with positive COVID-19. Healthcare facilities throughout Maricopa County submit requests for PPE to Maricopa County. These requests are reviewed and prioritized, with prior tribal communities follow a similar process, and in some cases, municipal team. Due to limited PPE supplies and high prices without positive cases, unfilled PPE requests are routed to the Arizona State 95 respirators, 149,450 surgical masks, 80,618 gloves. While we have distributed for a limited supply, with a supply chain that has not been able to keep up with demand. America's supply of PPE has included inventory from the Strategic National Stockpile, purchases by Maricopa County Public Health, the Arizona Department of Health Services, and also through private donation. Where to donate? If you have personal protective equipment to donate, you may drop items off at the donations warehouse at the reception area located at 16 from 9 a.m. to 1 p.m. Monday through Friday. If you have any questions about making a donation, you can call 602-66767. Maricopa County is putting maximum effort into acquiring PPE for all of our healthcare providers. We have ordered millions of units of PPE in advance of the demand, but we, like many others, are waiting for delivery. We are also coordinating options with local manufacturing partners to obtain additional PPE. Action for our healthcare workers. Thank you.
Director here in Maricopa County. At this point, we are going to open this up for questions for any of our news media friends who are on the
question. Jonathan, your microphone is unmuted.
Hi, question for Dr. Tony. 8 to 10 times the number of people doing contact investigation. When do you expect to get to that level? How much testing, tests per day or tests per week are necessary to give adequate level to make it an effective strategy?
All right, so a couple of different questions in there. 8 to 10 times the number of people we have right now. When are we going to have those? And also, how much testing do we need in order to be doing accurate or fully contact tracing? I'll let the question now, or those questions.
So because we are going to have Spanish translation, I'm just going to answer one. When are we going to be able to scale up to 8 times the current capacity? Have been working together with our intelligence team and a number of our partners, and we have a very detailed plan in place where we're going and implement enough of a workforce to increase our capacity by 8 to 10 times. However, we're still in the process of working with partners to implement that plan. Capacity that we have in public health alone, we'll be able to share a lot more with you.
Para tener una capacidad para poder hacer más pruebas, entre 8 a 10 veces más la capacidad que tenemos al momento, una fecha actual, pero se está trabajando en conjunto.
And regarding whether we have adequate funding to expand our capacity, we are fortunate that we have received some funding through the CARES Act to facilitate this maximal contact tracing. So we are in a much better position now than we were previously.
Con respecto a los fondos que exista, la realidad es que se ha obtenido fondos de lo que se le llama el CARES Act, que al momento trae los fondos necesarios para poder trabajar infectado.
And the last question, how much testing do we need to be able to maximally implement contact? Contact tracing is very much separate from how much testing there is. In fact, the amount of testing that is done, the more testing there is, the more people that we will identify as positive cases. Need to do more contact tracing. So the relationship is, as the testing increases, we need to be able to enhance our investigators and the number of people that we have doing the contact investigations to keep up with the testing. So it's more that we have to scale up.
Y el número de las personas que se hacen las pruebas que son dos cosas diferentes, pero al mismo nivel que se hace, incrementa el número de pruebas que se hacen para las personas que están infectadas, también con alguna persona infectada.
Thank you, Dr. Sonnenschein. Also, thank you.
Can't watch the
Okay.
internet. You can't watch the
let's go ahead and let's answer more questions from the webinar. And okay. So
What homes that have had COVID-19 outbreaks, they're having difficulty getting actually diagnosed?
of testing, and I'm not sure that's really within our control, but Dr. Sonnenschein can speak to that. And Joanna will also join her as well.
So the availability of testing, testing is widely available throughout the county. There are a number of, there's really no limit to who can access this commercial testing. What we're finding still is that the testing has more to do with having the supplies to collect the specimens and the personal protective equipment to collect those specimens safely. So long-term care, sometimes it's difficult to secure these supplies.
Bueno, la pregunta, existen las pruebas alrededor de todo el condado. Hay laboratorios que los están haciendo. Lo que tienen ahorita que si esos laboratorios y esos lugares no tienen el equipo de protección personal, se pone en riesgo a más personas. Esa es lo que existe.
All right, Ann, thank you so much for the question. Chad, do we have somebody else?
Justin Long has a question. He's ready.
All right, Justin. Justin, you want to go ahead with your question? Chad, why don't we go to the next one and we'll see if Justin can get the...
For Dr. Sonnenschein, what has the reception been like to contact tracing during?
So Peter, with the question about the people that we're reaching out to after we get a positive.
What I can tell you about is that we have contacting people who are infected with COVID-19 and with all of the other disease trust with these individuals. And that's why we take our confidence, because the public relies on us to keep that information confidential and not share it with anyone. It has a fundamental trust in our ability to keep that information confidential. We have been successful in working with people to get the information that we need to share with others to keep to inform them of their exposure and to keep the public safe.
La pregunta fue que sí, ¿cuál ha sido la respuesta del público contactadas por salud pública para hacerse la investigación en caso de COVID-19? Y la respuesta es que por mucho tiempo antes de COVID-19 existía ya la confianza de la comunidad, confianza en la comunidad y sobre todo para que exista la confidencialidad. Por eso es muy importante que salud pública no dé a conocer datos específicos, personas o los lugares, porque existe la confidencialidad entre el paciente y salud pública.
Peter, thanks so much for the question.
Go ahead and read Justin's question for him.
Okay.
As we have seen a rise in positive cases, how many people in Maricopa County are being each day for contact tracing? He has follow-up questions if there are time.
So the question, so out of all the people that have been contacted, say that again?
Each day
Each day.
for contact tracing.
Okay.
Day, it would just simply be the average of cases each day because we interview every single case every day and elicit their contacts through that manner. That on the weekends, testing availability drops, so those days tend to be lower, and then we start to see a rise on Wednesday when people who are getting tested on Monday, so often.
La pregunta era que si cuánta gente por promedio se hace las pruebas o se le viene haciendo el contacto. La semana se hacen las pruebas, por ejemplo, el fin de semana. Entonces, esos números están un poco bajos. Entre semana, empieza el lunes, la respuesta de los laboratorios regresa el miércoles. Y aproximadamente se ven entre 100 a 150.
All right, thank you, Chad, for reading those questions. Glad we were able to get Justin's question in there. Do we have anybody else on the webinar? Otherwise, I'll go to ABC 15 who text from his reporter.
We have a couple of new questions and a couple of follow-ups. Let's start with Leon Gonzalez.
Okay.
Leon, your microphone is live.
My question is related with Governor Ducey's order yesterday about elective surgeries allowed from May the 1st. What's your perspective, question, if it's possible, to remind us the resources for undocumented people in Maricopa County?
There's our take on Governor Ducey's executive order lifting elective surgeries as of next Friday. Dr. Sonnenschein, I don't know if but this is certainly something the governor spoke extensively about yesterday.
The governor's executive orders starting May 1st, as long as certain criteria were met. And I think the most important of those criteria to have sufficient personal protective equipment so that they are not relying on the state or the county to maintain their supply of PPE as they begin surgeries. So the remainder of the details, are continuing to be elicited, but it is important for elective surgeries to resume. They also have to be able to have the ability to get healthcare workers tested. We want people to continue to get the healthcare that they've come to expect here in the United States, and elective surgeries is really part they've come to expect here in the United States, and elective surgeries is really part of.
Y ¿cuál es la posición, la postura de la orden ejecutiva? ¿Cuál es la posición, la postura ejecutiva del gobernador de las cirugías electivas? La realidad es que se debe de seguir haciendo lo que viene siendo cuestión de salud, aunque sea electivo, siempre y cuando las instituciones, los hospitales, y no se esté esperando que el condado esté dándoles o supliendo el equipo de protectivas, porque es parte del cuidado de salud.
And the second question is for undocumented persons. And it's important, we know that a lot of people in our community struggling to make ends meet. And we have many resources available. One of them that I want to highlight is Find Help Phoenix. And that is what you're looking for, whether it's food or healthcare or anything in particular. You just click on the tab and it provides both free and ever service or item that people are looking for.
Bueno, sabemos que existe quizás en la comunidad bien mucha poder comer o cuántas necesidades tengan. Entonces, en cuestión de la documentación legal, queremos resaltar nosotros que tenemos un programa gratis o a bajo costo y la gente puede entrar y solicitar y ver lo que existe para la comunidad.
Yeah, first off, where will all this data be stored and is it, what's the turnaround on that? Once you compile this data?
And what data are we talking about?
From
contact tracing?
Contact tracing, yes.
Well, you're seeing that data every Maricopa County. We report that every single day. As Dr. Sonnenschein explained, every single one of those cases is available right there. Are we going to provide the expansive numbers of contact tracing? I'm not sure that's going to be made available on that, Dr. Sonnenschein.
I would just add that all the data and information that we collect from these interviews and from contact monitors and has an entire team focused on the security of that system, including so many firewalls itself, but it is the most secure system that I've seen. And we do take our confidentiality and our data security very seriously. And that's how we are so many sources in public health.
La forma que se mantiene la información confidencial y segura es que tenemos seguridad. Entonces es muy importante que nosotros continuemos con ese alto nivel de seguridad para resguardar la información médica, tanto de instalación.
So Chad, let's go back to a question from the webinar.
Thank you, Chad, and thank you, Lisa. Question for Dr. Sonnenschein. Given how you've described the hospitalization chart, the risk of using social distancing and perhaps going in the wrong direction, Do you think Governor Ducey might be moving a little too quickly? And is the county in sync with the state, or is the state syncing up with the county when it comes to the governor's plans?
Understand the multiple questions there, but we're not here at the county to make judgment calls on what the governor is seeing. He's seeing a lot of the same data that we are seeing, every data we've been seeing as far as the hospitalization epi curve. And yes, for the past, I believe it's about 10 days, we've been kind of bouncing up and down on a plateaued way. I'll let Dr. Sonnenschein address that and then how that informs our decision. And of course, the governor is getting that same information every single day, at not only statewide, but certainly way. I'll let Dr. Sonnenschein address that and then how that informs our decision. And of course, the governor is getting that same information every single day, at not only statewide, but certainly here at the local. Our two groups talk every single day. But I'll let Dr. Sonnenschein expand a little bit more on what we're seeing on that hospitalization epi curve and how it.
When we track the hospitalization epi curve, what you've seen is that the hospitalizations, and then they flattened, and then they started to come down a little bit. And the way we interpret that is we don't interpret a decline at all until we this for at least several weeks. And so what you'll find when you interpret all of the different methodologies that are out there for pulling back on social distancing, and that once you make one decision to pull back on something, you wait, and you wait at least 2 to 4 weeks, if not more, you make the next decision. And my understanding is that Governor Ducey is going to follow a similar plan to that, ensure that everyone's safe, and then slowly pulling back more on social distancing as moving forward. So we're very much in support.
Esa la pregunta era que si en cuestión de las hospitalizaciones, si vemos que están subiendo, han bajado y si estamos en acuerdo con lo que el gobernador ya el mes de mayo. Entonces, aquí lo que estamos viendo es que se da seguimiento a todos los casos, a la gráfica de epidemiología, se puede empezar a relajar el distanciamiento social. Y eso se tiene que hacer por 2 a 4 semanas y lentamente, poco a poco, gradualmente, es como cambios de empezar a la normalidad.
Thank you for the questions, Bram. Chad, do we have anybody else on the webinar?
Laura Gomez has a question.
Hi, thank you for this opportunity. I got kicked out of the session halfway through your statement. So if I'm asking you to repeat yourself, is this happening over the phone? Are they showing up in your house? Are they texting you, emailing you? Just concern legitimate contacts from county health departments and maybe scammers. And then also, I don't know if you mentioned this, but doing contact investigations, what's the current staffing level? And yeah, those two things.
Okay, I can the basics for you. Dr. Sunshine said earlier, we currently have 25 investigators on staff who call people directly and use whatever contact information we might have to reach those people as we positive test, and we reach out to every single person that has a positive test. So that was one thing, and I believe it's not 8 to 10 more people, it's 8 to 10 times the number of people we have right now. Expand on anything more about that. So we reach out to every single person, 8 to 10 times more people involved in that as well after I give this answer. But Laura, does that answer all your questions? Sorry, you answered several or asked several there.
Have you been doing contact testing since the very beginning of tracking COVID-19?
Yeah, so Dr. Sonnenschein went into quite a bit of detail on that, on the lot of people that were involved in this, or a whole lot of cases, I should say. They were, our investigators were but we're contacting every single potential contact of that person. And as she explained earlier, that's healthcare workers, family members that are most at risk. And then also after that, the cases to help us expand that reach a little bit by contacting their own contacts. Right now, what we will want to do to have a more complete survey in our community is we staff up, we put this plan in place, and we will have more people. So we go back to directly contacting every person who is a potential contact. So
Entonces, la pregunta era que si se han estado haciendo ese tipo de contacto, seguimiento con las personas que pudieron. Siempre he trabajado con investigadores, ese tipo de procedimiento siempre ha sido usual, donde hay un contacto con una enfermedad completamente, se le deja saber a la persona y se hace un historial precisamente para evitar que se siga propagando la enfermedad. Entonces, al momento existen 25 investigadores en el condado de Maricopa, otros más para poder tener más alcance en la comunidad, y al momento se está utilizando la forma en que las personas que resultan positivas tienen que también contactar a las personas con las que ellos estuvieron en contacto, y dejar datos. Lo mismo hace Salud Pública con esas instituciones de salud que trataron a esta persona infectada.
Do we have anybody else on the line, Chad?
Yes, Bob Christie has a question. Bob, your microphone is live.
Thank you. Bob Christie with the AP, trended slightly and leveled off. And not only Maricopa County, but statewide, we've seen a big rise in deaths this week. Now we're 21, 21, and 20 in 3 consecutive days. So can you talk to us about what we should be interpreting any indicator, whether this is your nursing home population that you've seen a rise in deaths in, and help us understand whether we should expect this level.
Reports and stuff. Dr. Sunshine will answer that.
Are following our deaths very, very closely. We do expect that the number of deaths, always know that when we see a rise in cases, about 2 weeks later, we're going to see a rise in hospitalizations. And so we always know that when we see a rise in cases, about 2 weeks later, we're going to see a rise in hospitalizations. And then we tend to see a rise in the deaths. And that's because once people are hospitalized, a death, if it's going to occur, often takes several weeks, and then it needs to health. So we were anticipating an unfortunate rise in the deaths when we saw the rise in hospitalizations before, and we hope that as to see the deaths leveled off. And as you astutely mentioned, we definitely expect that the majority of even older and who have chronic medical conditions, and tragically, a lot of those individuals are residents of long-term care, away from the very beginning to reach out to all long-term care facilities, broadest sense. So that includes assisted. And we contact them weekly. We ask them how many people have respiratory symptoms in their facility, how many people have been hospitalized, how much personal protective equipment they have. And we work with them to get those individuals tested right away. And if there's a case in the facility, or if there's a healthcare worker, incredibly strict set of infection control recommendations that we walk through with the leadership of the facility. We make sure that every resident has meals alone in their room, and actually even covers their mouth and nose when a healthcare worker walks in, and the healthcare workers have to wear a mask they're in the facility, and wear gown, gloves, mask, and eye shield every time they interact with a resident. So we know that sounds like a lot, but that is what it takes to keep COVID-19 from spreading once it gets in a facility. And what we found is that the vast majority of facilities who implement these precautions are able to keep it to 1 or 2 cases, but there are situations where we've seen a lot of spread, and tragically that is why we're seeing this increase in deaths.
La pregunta era que si el alto en las personas, ¿cómo se debe de interpretar? La respuesta es que se esperaba que subiera el número o el índice de muertes. Una vez que vemos el número de casos de hospitalizaciones que ha subido, tarda en reportarse. Entonces, una vez que suben las hospitalizaciones, va a subir el número de muertes en las próximas semanas. De la misma manera, una vez que empiecen a bajar, con referencia a cómo se trata eso con las personas de la tercera edad o los grupos de alto riesgo, una vez que se detecta quizás algún caso específico, los centros de cuidado médico de largo plazo, lo que se trabaja muy de cerca con ellos para ayudarlos que estrictamente tengan la forma, el material adecuado de protección de la cara, las batas médicas, una vez que interactúan con alguna persona que ha estado infectada, y poner a esa persona en aislamiento en su cuarto donde pueda y hacer todas sus actividades. Todo el personal tiene que usar el equipo de protección personal. Y hemos visto que se ha podido controlar cuando se detecta una forma temprana.
So we have time for probably 2 more questions this afternoon. So Chad, do we have anybody else on the webinar?
We do. Justin has a follow-up, which I will read for him.
Okay.
Justin asks, sources are being directed to long-term care facilities. Can the department keep up with the demand?
Okay, so the question, or at least the last few bits of supply have been appropriated. So Robert Rowley can answer that question today about PPE.
We have less left to distribute. Really depends on which one we're talking about. The most critical one at the moment are surgical gowns. We are down to just a great cooperation from our city partners that are sharing some of the supply that they have to make sure that our most critical facility. But that certainly is our biggest concern at this point. The next is a tie between N95 masks and face shields, which were to 2 to 3 weeks on each of those. And
Entonces la pregunta era que si, ¿qué es lo que en este momento viene siendo las batas médicas quirúrgicas, especialmente para los centros de cuidado médico de largo plazo? Y también se necesita solamente varias semanas solamente para poder tener ese tipo de mascarillas. Y las batas quirúrgicas que solamente se tienen como para 2 semanas.
Wants to ask a question on the webinar today.
We have one person who has not had a chance.
Okay, let's go ahead with their question.
Take, Tom Scanlon.
Okay.
Thank you. When will you provide the names of long-term facilities that have had positive COVID-19 tests? And when will you update cumulative?
So I'll let Dr. Sonnenschein will field both those questions.
Providing specific names and data associated with long-term care by individuals who live in those facilities. And furthermore, it is very important that we continue to maintain a relationship of trust, implement all of the infection control recommendations that we have. We strongly encourage long-term care families that live there and share all of the information about what infection control precautions are being implemented, whether there are cases in the facility, be a CMS requirement, the details of which are going to be released. So as long as the residents and families are being made aware of the cases in there, and we have no intention of releasing those data.
La pregunta era cuándo vamos a dar a conocer los nombres de los centros de cuidado médico de largo plazo, esa información. Sin embargo, se trabaja muy de cerca con ese tipo de centros de cuidado de largo plazo, médico de largo plazo, para que ellos estén informados, hablar con las familias y los residentes, y decirles la situación de lo que está pasando, y ellos son los que comuniquen. Nosotros no daremos a conocer esa información.
Okay. Thank you very much, all of you, for being with us today for the webinar, for this this live press conference here on Facebook and YouTube as well. You have further questions, you want to pass them along to us, caomedia@maricopa.gov. We always do our best to get to everybody every single day. This webinar today, and thank you to our friends in the media for all the good questions. We certainly want to keep you informed as best we can during these difficult times and during this